health planning in India. In that there are various committees. The first committee is bhore committee. Year is 1946. Next committee is mudhaliyar committee 1962. Next one Chada committee 1963. Mukerjie committee 1965 and 1966. Jangalwala committee 1967. Katar Singh committee 1973. Srivastav committee 1975. Rural health scheme 1977. So these all are the committees in the health planning. We can see one by one. Bhore committee constituted by pre-independent government of India under Sir Joseph William Bhore, Indian civil servant, and formed this committee in 1943, and it is known as Bhore committee is otherwise known as Health Planning and Development Committee. Health Planning and Development Committee is the other name of the Bhore Committee. Here, comprehensive proposal for the development of national program of health services. We knew that there are national level programs like TB eradication program, malaria eradication program, like lot of national programs are there. So comprehensive proposal of this development of national program, it is constituted by Health Survey and Development Committee. Integration of preventive and curative services at all levels. The Bhore committee give importance to the integration of the preventive and curative services at all levels. And the Bhore committee developed the concept of primary health care. Development of primary health care mainly in two stages, that is short term level and long term level. So this is regarding the Bhore committee. Bhore committee is otherwise known as Health Survey and Development Committee. It is formed in 1943, and the committee submitted his paper in 1946. So the main proposal is development of national programs of health services, then integration of preventive and curative services at all levels, and development of primary health care in two stages, short term goal and long term goal. Next one, Mudhaliyar committee. Mudhaliyar committee constituted in 1959 by Government of India under Dr. A. Lakshman Swami Mudhaliyar, Vice Chancellor, Madras University. The Mudhaliyar committee, otherwise known as Health Survey and Planning Committee. Mudhaliyar committee also known as the Health Survey and Planning Committee. Advice for the strengthening of existing primary health care centers before new centers were established. So the first advice for this committee is strengthening of the existing primary health care prior to the development of new, or prior to the establishment of new centers. Second advice is strengthening of the district hospital with specialist services to serve as a central base of regional services. So next proposal is strengthening of district hospitals with the specialist services. And also the Mudhaliyar committee give importance to the integration of medical and health services as recommended by Bhore committee. Mudhaliyar committee also give importance to the integration of medical and health services. Then constitution of all India health services on the pattern of Indian administrative services. So these all are the recommendations for the Mudhaliyar committee. It is in 1962. Next one, Chada committee. It is in the year of 1963. A committee of health administrators and malariologists reviewed the National Malaria Eradication Program constituted in 1963 by Government of India under Dr. M.S. Chada, Director General of Health Services. The monthly home visit should be implemented through basic health workers. Chada committee proposed monthly home visit through health workers. Next one, the workers were envisaged as multi-purpose workers to look after the additional duties of collection of vital statistics and family planning in addition to malaria vigilance. So, the Chada committee proposed the name of multi-purpose workers. The family planning health assistants were to supervise 3 to 4 of these basic health workers. So, the Chada committee, it constituted in year of 1963 by Government of India under Dr. M.S. Chada for the purpose of multi-purpose workers for the eradication of the malarial program. So here the multi-purpose workers, they are carrying additional roles like assessment of vital statistics, family planning, then in addition to malaria vigilance. So the basic health workers or the multi-purpose health workers, it is contributed by Chada committee. Next one, Mukerjie committee. Mukerjie committee in 1965, following the Central Family Planning Council meet at Madras, constituted in 1965, headed by Sri Mukerjie, Secretary, Ministry of Health and Family Planning. Here, separate staff for the family planning program. He proposed a separate staff for the family planning program. The committee also recommended to de-link malaria activities from family planning. So, in 1965, Mukerjie committee proposed that a separate member for family planning purpose only, and he de-linked the malaria activities with the family planning. In 1966, Mukerjie committee again proposed the committee work out the details of the basic health services which would be provided at the block level and some consequential strengthening required at higher levels of administration. So in 1966, Mukerjie committee worked out the details of basic health services which should be provided at the block level and some consequential strengthening required at a higher level of administration. That is the proposal that is given by Mukerjie committee in 1966. Next one, Jangalwala committee, that is in 1967. Integration of health services from top to bottom, similar seniority and unified cadre to be implemented, elimination of private practice by government doctors. So, Jangalwala committee in 1967 by Dr. Jangalwala, he proposed the elimination of private practice by government doctors and also give importance to the unified cadre for each group. Next one, Kartar Singh committee. Here, a meeting of the Central Family Planning Council 1972 by Government of India. In 1972, the Committee on Multi-Purpose Workers under Health and Family Planning. Kartar Singh, Additional Secretary of Ministry of Health and Family Planning. Report in 1973. So the Katha Singh Committee, it starts from 1972 to 1973. The Government of India constituted a committee in 1972 known as the Committee of Multi-Purpose Workers under Health and Family Planning under the chairmanship of the Katha Singh. So that is the Katha Singh Committee. He contributed the multi-purpose workers. Chadha Committee gives the multi-purpose workers, the envisaged multi-purpose workers for the malaria vigilance, for the surveillance of malaria, and also they give additional roles like vital statistics and family planning. But Katha Singh Committee, the Katha Singh Committee is known as the Committee of Multipurpose Worker under Health and Family Planning. Under Health and Family Planning, there is no multipurpose workers. So that constituted by Katha Singh. In Srivastava Committee in 1974 to 1975, the Government of India in the Ministry of Health and Family Planning had in November 1974 set up group on medical education as a support manpower, popularly known as the Srivastava Committee. So Srivastava Committee give importance to the group of medical education and support manpower. That is the main proposal of Srivastava Committee in 1975. Rural Health Scheme, that is 1977, following the recommendation of Srivastava Committee, government launched Rural Health Scheme. The main aim of this program was to train the community health workers. So Rural Health Scheme, that is in 1977, it is followed by Srivastava Committee. Here we are giving importance to the training of community health workers. So the bhore committee, that is in 1946, mudhaliyar committee in 1962, Chadha committee 1963, mukerjie committee 1965 to 1966, Jangalwala committee 1967, Katha Singh committee 1973, Srivastava committee 1975, rural health scheme 1977. In conclusion, bhore committee is health survey and development committee. Mudhaliyar committee is health survey and planning committee. Chadha committee give importance to the national malaria eradication program by health workers. Mukerjie committee strengthening of health services. Jangalwala committee on integration of health services. Katha Singh committee on multi-purpose workers. Srivastava committee for medical education and support manpower. Thank you.